Hello, my name is Aldo Duarte. I am going to tell about Disseminated Fusariosis. Fusariosis is an emerging infection disease in immunocompromised patients that may present as a localized stem infection, mycetoma, or pneumonia. Disseminated fusariosis, which is limited to immunocompromised hosts, especially hosts with a hematologic malignant disease or hematopoietic stem cell transplantation, is characterized by fungemia, skin lesion, and multiple organ involvement.
Disseminated intravascular coagulation, or DIC, describes a situation in which the process of hemostasis, which is when, after blood vessel wall injury, liquid blood rapidly becomes a gel, called coagulation, or clotting, starts to run out of control. When this happens, lots and lots of blood clots start to form in blood vessels serving various organs, leading to organ ischemia. DIC, though, is also called consumption coagulopathy, because all this clotting consumes platelets and clotting factors. Without enough platelets circulating in the blood, other parts of the body start to bleed, with even the slightest damage to the blood vessel walls. So paradoxically, patients have too much and too little clotting.
Sign up for a free trial today and watch the full video on osmosis.org.
Application in nursing. The nursing staff use a combination therapy of drugs such as voriconazole and potassium B deoxycholate to treat disseminated fusariosis infection in one patient. The patient have a presentation and clinical course as described for invasive fusarium, prolonged neutropenia, persistent fever despite broad-spectrum antibacterial therapy, development of multiple skin lesion. Pros and cons. The definitive diagnosis of fusariosis requires the isolation of fusarium SBB from clinical specimen, blood, skin, lung, odor. The clinical manifestation of other gynomycosis are not distinctive or resemble those of invasive aspergillosis, which include pulmonary infection, sinus infection, central nervous system disease, and locally invasive infection.
Fusarium is a genus of fungi that is widely distributed in soils and can be a cause of indoor air quality problems and properties with elevated mold levels. Most species of Fusarium are harmless, but others can cause costly plant damage, spoil cereal crops through the production of mycotoxins, and cause opportunistic infections in humans. Mycotoxins produced by some species of Fusarium have even been researched as potential biological weapons in the past. In homes that have suffered water damage or elevated humidity resulting in mold growth, Fusarium is sometimes found in surface and air samples. Exposure to high levels of mold may cause allergic reactions in some people and act as a trigger for asthma in others. Some species of Fusarium can cause a host of opportunistic infections in humans. People with healthy immune systems may develop infections of the nails or in the cornea. In 2006, the CDC investigated an outbreak of Fusarium keratitis that was associated with a specific type of contact lens solution, which was later withdrawn from the market. In 2011, USA Today published an article about the high rate of Fusarium that was found in a research study that tested sink drains in homes, businesses, and institutions. This was discussed as a possible source of Fusarium infections. People with weakened immune systems may develop aggressive infections, impacting the bloodstream and entire body. Fusarium infections can be difficult to treat as they are often resistant to many antifungal drugs. To learn more about Fusarium, fungal pathogens, or other indoor air quality contaminants,
As to apply in Ecuador. In Ecuador, a case of fusariosis infection was treated in adult patient with hematologic neoplasia who was under chemotherapy treatment. Involvement prolonged refractory febrile neutropenia was treated with a broad antibacterial skin and developed a multisystem infection. He was refractory to antifungal treatment with potassium B deoxycholate and caspofungin used sequentially. Conclusion: prevention of infection in colonized patients, maintenance of a high degree of suspicion for early diagnosis, and the combined vigorous and prolonged use of LIMB and voriconazole are essential to decrease the mortality of this devastating infection.